I will not go into all sorts of the hello and whatever.
Yeah. And you can edit this. So.
Yes. Dr. Kipperman, what do you think is the outstanding feature of the concept, of the CurePatch concept?
Well, currently we don't have any good ways of monitoring patients except for with wires and sensors that don't communicate wirelessly. So in order to, whatever parameter we're looking at, whether it's oxygen saturation or blood glucose or an ECG signal, it's very cumbersome for patients, and currently we don't have any technology that exists that can obtain this kind of information in real time in a way that's comfortable and convenient for the patient, and that can give us real-time information. So the concept of CurePatch would be revolutionary if we could have a small flexible patch with embedded sensors that could monitor whatever parameter, but things that are important for us as physicians is oxygen levels, ECG, 12-lead ECG signal, as well as glucose monitoring and many other signals. But those alone would revolutionize the way we take care of patients. And I think to have something small, flexible, easily wearable that didn't have to be recharged and was inexpensive would be a big advancement in treating patients.
Would you say that, well, the healthcare as we know in this country would be changed because doctors would be relieved from chores and will really work on something more important?
Absolutely. Most of our care at the present time is interval care. We see patients, when they're an outpatient, we see them, as a cardiologist, we generally see patients at 3 to 6 month intervals. So we don't really have any real-time information about what's going on between. And many of the conditions that we treat these patients for, some of these syndromes occur suddenly without warning. And these patients have to be aware of the symptoms and the signs to get to the necessary help. If we had a way of monitoring these patients continuously to find out about these problems at the time they occur, we can certainly treat patients much faster and even prevent problems from happening. So it would be a whole new paradigm in the way of treating patients.
How marketable do you think would a device like CurePatch be?
It would be instantly marketable. I mean, it would be revolutionary. So I think this kind of device would just transform the way we take care of patients, whether it's cardiology or even other chronic conditions that require monitoring, diabetes, pulmonary disease. Every field would be transformed by a sensor that's self-powered and flexible, inexpensive, and can wirelessly communicate with their physician or their physician assistants.
I understand that you met with Dr. Goldstein.
Yes.
In the company of several other doctors.
Yes.
What do other doctors think about it?
They all agree. I introduced him to Dr. Schreck, who has a system for doing 12-lead EKG from 3 leads, and this would be. He said he would like to have this, this sensor today if it was available, and it would be if we could have 12-lead EKG information, continuously on a patient with coronary artery disease, it would be just a wonderful thing to have. So there would definitely be a market for this in probably every field of medicine.
Okay, thank you. May I check